focusing on two examples from two current, actually one was recently completed and one ongoing major EU funded project, which we are both of our Eurocares consortia projects. So and then obviously I will leave some time for questions. But first of all, if I can start by giving you all a flavour of what I call the state of play or the state of art with regards to international young carers research at the moment. Stephen Joseph, Joe Sempic, Agnes Liu and Saul Becker have been working together now for several years, and they wrote a very good paper recently where they really reviewed where we're up to in terms of research in the area of young carers and where the gaps are. And so when I start, and you'll see the first point on the slide is quite negative, but I think that it's safe to say generally that that we do have some research in our different countries in Europe, not all European countries, but we do have some research, and there is some research in the in some African states and in Canada, Australia, for example. But the majority of the research is quite small scale and it's descriptive. And at the same time, so because of that, it's difficult to make generalizations based on our results. And also at the moment, it's quite a hinder that there is no single definition of young carers. So the prevalence, how many young carers there are, tends to differ between our countries, for instance, in Europe. And so look quite different, as I'll show you in a moment, and that's quite a challenge. So what they argue for is for us to think about having about thinking of young carers and caring in quite a new way, in terms of thinking about caring in terms of a continuum. It isn't just you're doing that or you're not doing caring. That it's to think of it more in what they call concentric circles going around like this, where at the outer level we're caring about, and then as we continue we may be caring for, and then those carers right in the very middle that are carrying out really intensive amounts of caring, those needing care. So they think that continuum of caring is much more useful and meaningful, not only for research but also for policy and practice, because then if we're thinking about that outer level of caring about, we can think about prevention, and then in the middle we can think about assistance, and then in the center we can think about mitigation or trying to reduce as much of the negative impacts of caring as possible on those young carers that are carrying out an extremely heavy caring workload. So they also argue as well that we should have more theory-driven research. And they argue, and I think I agree with this, that at the moment sometimes there is a tendency to think of all caring carried out by young carers is harmful. It's going to have harmful effects, whereas we know that some young carers are very resilient, especially if they're caring about someone or they are caring for, without doing too much excessive amounts of caring, that in actual fact that can lead to quite a high level degree of empathy, and one may indeed it isn't all black and white, and that it's all a negative thing, which tends to come with having a medical view. But what they do argue as well is that the view of young carers research is very much from the researcher's viewpoint. And they argue that we need to have much more participatory, action-led research that can really focus on the everyday realities of young carers and to hear their voices within our research. And I think we would all agree that that's very important. And at the same time, we need to come together and address the topic different disciplines, so not simply from healthcare or social care, but from a wide variety of disciplines, such as education, such as law, and so on. And really what's so important, and this is what we've been trying to do in our two projects, is to really lobby, to combine the lobbying and champion activities that carers organisations can do so well, together with more country specific research, that then those two together can influence politicians and policymakers and lead to change. And I'd like to now show you, in the context of a major EU Horizon 2020 project that I'm leading, and that is a Eurocarers consortium, how we've tried to do all of those things that I've just spoken about. And our focus here is very much on a preventive approach. And the project's called MeWe, and that is promoting mental health and well-being among adolescent young carers in Europe. And it's a consortium consisting both of research organisations, universities, together with carers organisations. And it involves countries with different levels of awareness and different types of support for carers. So it includes ourselves in Sweden, it includes the Netherlands, the UK, it involves Slovenia, Switzerland, Italy and the Netherlands. So all very different, but coming together to work together in this project. And it started at the beginning of 2018 and it goes through till the end of May next year. And we're focusing on adolescent young carers because we see that as being a key transitional phase for moving from childhood into adulthood, and there's quite little research in this particular area. But at the same time, we know it's a critical, as I've just said, transition phase, and with adolescent young caring comes some risks that we can't ignore in terms of mental health and well-being, in terms of health inequalities, but also social exclusion, so that those adolescent young carers that are caring for or are actually needing care have a much higher dropout rate from school, and then in later life have a much less chance of getting paid employment. So this is why we focused on those adolescent young carers aged 15 to 17 years of age. And when we looked at our countries, we saw that in actual fact, there are very few countries that really have developed any dramatic levels of awareness, perhaps with the exception of the UK, but neither have they developed any specific policy or support services either for adolescent young carers. So we saw this as being a strong rationale for carrying out our project. So what we're focusing on is trying to strengthen the resilience of adolescent young carers, trying to help them to grow as individuals and to thrive in life. But as I say, coming in at that preventive stage before there is a crisis. This slide is rather a busy one, but as you can see, we're doing a lot of things in the project. In the first year, as you can see on the left-hand side, hopefully it is on your screen, we were what we call systematizing knowledge on adolescent young carers. So what is the situation of adolescent young carers? Who are they? What do they look like? And then what are the policy, legal and service frameworks looking like in all our countries? And then what are the good practices that we can find in the literature or that we know about? And then in the second phase, we were together with adolescent young carers, what we call co-designing a support intervention that they would find meaningful and useful. And then we have implemented this in all our countries and are now evaluating it. And at the same time, running across the entire project, we're carrying out what we call wide knowledge translation actions. So headed up by Eurocarers, we're continually disseminating our results so they can feed into policy and practice. So we kicked off by having an online survey with adolescent young carers in all our 6 countries using the instruments of Saul Becker and colleagues. And I'm just summarizing here very quickly because of the time, but we found this was the first really cross-national study of its nature, of its kind. We weren't able to secure really representative samples of adolescent young carers, but still we found a lot of important findings. We could see quite high levels of impact on mental ill health due to caring, particularly in the UK and in Switzerland. But we think that was due to the fact that many of the young carers were recruited from carers organisations where they were already known. And it also led to some very interesting insights into the nature of family caring as a young carer in Europe. For instance, many young carers in Italy care for their grandparents, whereas in Sweden there are many siblings that are caring for a sick brother or sister, and the same in the UK. And then we found, of course, as well, that the welfare, that the nature of the welfare state system also influenced the level or not of formal support and the extent of informal support for young carers. So we're now busy writing up these results, and I'd like to share with you a recent publication that's been led by our colleagues in Italy. Sara Santini and colleagues have written up and just published a very exciting paper focusing for the first time on adolescent young carers caring for grandparents. So, and it is an open access journal, so you're very welcome to access this, and I've got the link so I can share it with you. At the same time, we looked at the policy, what's available, what's there, what isn't there, what's the legal rights for young carers in our country, and what are the services provided. And what we saw, and we used Lou and Becca's ladder, this awareness ladder, and it showed that we were all at very different stages of awareness and support. As you can see at the top here, we have the UK that have, as you're probably already all aware, quite specific and targeted legislation for young carers and quite well developed supports for young carers, often carried out by the voluntary sector. In Sweden, we were fairly high, and this was because of the provision in our Healthcare Act, where we have a paragraph that states that professionals shall reach out to and offer information to children as next of kin when they come in contact with them. And as you'll see further down, we have Italy and Slovenia. We have Italy, the Netherlands and Switzerland. And towards the bottom of the ladder, we have Slovenia. But I can say they are moving all the time, and the Netherlands has started to do some fabulous work this last year. So it is constantly changing. But I would like to say as well that Agnes Liu has recently submitted a paper, so these findings will also come into the public domain, and we can share them with you very soon as well. A third piece of work was a major Delphi study. It's a type of interview study where you try to gain consensus on a very new topic. So the topic of adolescent young carers fitted very well. And these interviews were done with a range of experts in all our 6 countries. And this has led to a further publication that's just been accepted that really highlighted the awareness, visibility and supports for young carers across Europe in all our 6 partner countries. And if I can just highlight some of those results for you. What we found was, again, awareness and visibility varies greatly among our countries. The support programs that are out there are mainly on a local level. They're not always aimed at young carers, but that isn't necessarily a bad thing. There are a lack of systematic studies, so again, it's very small scale, often qualitative, but there is a great role for trying to reduce stigma And very important, it was highlighted, support and training for adults and professionals that come into direct contact with young carers. But the message was very much to build support in co-creation with the young carers themselves and to stimulate social interaction so they don't become isolated. And they thought there was great scope for more online support as well. So once we'd gathered all that knowledge, it has led to us then being able to, together with young carers, design our support intervention. And I'll just click on all of these now. I want to share with you that in our project, young carers have been very much at the centre of it from the beginning, and we're trying to hear their voices in a variety of ways. First, by the Young Carers Working Group, who regularly at their meetings and via email or chat share with us their views, their feedback on how our project is going and on our outputs. And then also we have equal numbers of young carers in our external International Advisory and Ethics Board. So we have young carers from from Australia and from across Europe, and their input is invaluable. And we meet twice a year online. We also have had workshops with adolescent young carers to help us design a mobile app together. But I'd like to share with you our work with what I call blended learning networks, because this has been a model for really bringing all the stakeholders together to help us to co-design our support intervention and to advise us on every step of the project. And I think it's a model that could be used very usefully, possibly in Finland if you aren't already doing something similar to this. So basically then, and I'm sorry, I'll put it all on to save a little time. Blended learning networks are basically communities of practice. So they bring together people with different backgrounds, experiences, but they all are passionate about the topic. So in this case, it's young carers. And the idea is that they share experiences with each other and they learn from each other. And in our case, we wanted to bring together not everyone from the same background, but those with very different backgrounds. So we've carried out blended learning networks in each countries about once to every 8 weeks or once every 3 months to help us to give advice so we can learn together, to co-design the intervention, to help us gain insights into the evaluation, and also how can we best sustain the project when it's finished, because we want to continue with our important work. Originally they were face-to-face, but they were also online in Italy because they were the members were spread out across the country. So they were online, but now since COVID-19 in March this year, many have been online. Oops, sorry, and that's a bit too much over there. But who takes part, you can wonder? Well, young carers themselves and their organisations, where there are organisations, young care organisations, but also health and social care professionals, professionals from school, the teachers and other school staff, youth leaders, together with ourselves researchers. So it's quite a varied group, and the exact dynamics of the team vary from one partner country to another. But I think it's been a really useful tool for us to use throughout the project, and we think it's something that we will continue with when the project is over as well. This is quite a busy slide, but it basically shows our intervention that we've co-designed together. And it's focusing on what we call a primary prevention. So we want to come in very early before there is a crisis situation. And it's focusing on positive psychology based on acceptance and commitment therapy. So it's very much about being aware of one's emotions, helping an adolescent young carer to find ways to move beyond their negative events and to help them to grow and learn, and to be aware of their emotions and to expand their repertoire. And it's called and this model is called, it's based, our MeWe model is based on the DNAV model. The D stands for discoverer, N for noticer, and A for advisor, and V are values. And we work with all of these components very carefully in 7 weekly sessions with 2 facilitators that are trained and supervised in the model. And this is the overview of the intervention itself. And before COVID-19, we delivered this face-to-face in the UK, in Slovenia and Italy. But in Sweden, Netherlands and Switzerland, we decided that we wanted to use both our MeWe mobile app that we've co-designed with young carers together with face-to-face. So we called it a blended approach. However, just as we were starting to all get off rather well with our implementation, COVID-19 came, and so all the countries have gone fully online, which has brought with it a few challenges, to put it mildly. So this is some of the feedback from our very first Swedish MeWe group. As you can see here, very positive feedback. This is purely the qualitative feedback at the moment, because we haven't yet completed data collection, and it is a randomized control trial, so it's quite strict evaluation method. But this is some qualitative findings directly from young carers when they finish the final session, that they've learned to know themselves, how I think in different situations. I can listen to what my inner voice says and make assessments from that. I pause to sense my feelings, and that they've gained a better self-esteem. So all of the things that we were hoping would happen, they've expressed them themselves, which is really great to hear. Out of all our work that we've done, as I say, we're wanting the whole time for the research that we do to make an impact on policy at EU level and at the member state level. So it's been a massive awareness raising campaign among all our stakeholders. And what we've had is, from our research work that we've done that I've just explained to you, Your Carers, and it's Francesca Centola, our dedicated young carer officer, has done a fantastic job of creating more easily accessible tools for us that we can take up and use with our politicians and stakeholders. So we have an EU-wide and 6 country-specific policy briefs. We have an online booklet for adolescent young carers, and we have a manual for stakeholders, and these are all available via our website, so you're welcome to have a look at them, and they're all in our partner countries' languages, as well as having an English version, if you like. So I think, yes, so that was my final slide with the MeWe project, and I realise it's a very busy, it's been a very quick presentation, but I felt it was so important to share with you some of our findings and the ways that we've been working together. I also want to share with you quite a different project. This is called the Edicare Project, and it's just finished. And this was funded by the Erasmus Plus programme, which has a strong focus on education. So this was a much smaller project, and it wasn't as much multi-agency working as it was focusing on schools, because as we know, that's where young people, children are, or should be, most of the working week. So I'd like to share with you some of the main learnings from our project, particularly some of the tools that I can share with you. And the aim was to empower teachers and other school staff so they could reach out and recognise adolescent young carers. In this case, it was 16 to 19, and to try and maximise those young carers' learning opportunities, and at the same time ensure their social inclusion. So what we have is a range of concrete project outputs that are all available cost-free. We have an assessment tool for use by school staff that we've devised based on the work of Saul Becker, but it has been revised and adapted. And I haven't said, and I'm sorry, if I can just go back a moment and explain very importantly the partners that are involved. We're coordinating it at Linnaeus University, and it's also in partnership with Carers Portugal, with the University of Ljubljana, with Eura Carers, and with Anziani in Solo. That's a very active cooperative in Carpi in the Emilia-Romagna region in the north of Italy. So the assessment tool is in the partner countries' languages, as well as being in an English version. We also have a checklist for school staff to help them identify young carers. So what are some of the signs? What are some of the indicators that you can be aware of to help make their life easier? And we also have got a handbook for teachers and school staff as well, that gives a range of good information, and gives some examples of good practices in the area as well. And finally, we have what we call our Edicare Mooc, a massive open online course that's very straightforward, has 3 modules that can be used, taken by school teachers and school staff. I'm afraid there isn't an English version, but there is a Swedish, Italian, Portuguese and Slovenian version. And all of these are available on the Eura Carers website. So I realise that's a very quick overview of Edicare, but I just wanted to share with you some of the outputs that I think could be useful to share with you. My conclusion and next steps is that I think to move policies and practices forward for and with young carers, we need to be thinking in 2 main ways. And here I think the roles of our Eura Carers Research Working Group and our Eura Carers Young Carers Working Group are very important, because the Research Working Group can help to provide robust and reliable country-specific research, but we need the advocacy work as well. So the Eura Carers Young Carers Working Group, together with our carers organisations, can help to take up that research evidence and use it in their awareness raising activities. And together, and only together, I would argue, can we change mindsets, policies and practices. And with that in mind, I'd just like to do some advertising for our 3rd International Young Carers Conference that will take place on the 3rd to the 4th of May next year in Brussels. We're very much hoping it can be in real life, but if not, we will have a B plan and have it online. We're co-hosting it, our Swedish Family Care Competence Centre, together with Eura Carers, and it is a very much a multi-stakeholder event. Young carers, their organisations, and a range of stakeholders are welcome to take part. So it isn't simply a research conference, because we really want to create that awareness and change. And the members of the Eura Carers Young Carers Working Group have come up with the main themes of identify, support and listen to. And with that, I'd like to leave it at that. I realise it's been a very fast presentation, but you're welcome as well, of course, to contact me after the seminar, and I'm very happy to answer any questions or to share materials with you. So thank you very much for your attention.